Good afternoon. I'm Brian Bauer. I am the founder and executive director of the Abundance Foundation. Show of hands, who in here knows somebody that's been impacted by addiction? So majority of the room, that's about what I'd expect. Now the information that I'm going to reveal to you today is going to seem overwhelming, hopeless, depressing, but what we're going to get to is actually a very simple solution to this complex problem. So just bear with me and buckle up. There were 48.5 million people aged 12 or older in the United States in 2023 that were struggling with a substance use disorder and therefore in need of treatment. That's the same as the total population of Oregon, Minnesota, Tennessee, Nevada, Colorado, Oklahoma, and New York combined. So the odds are that everybody probably knows somebody. Now, I'm one of those people. I've been sober since August 5th of 2012, but thank you. Just prior to that, though, I woke up one morning and I was coming out of another alcoholic seizure. I was shaking from the DTs. I had sweat pouring out of every pore in my body. I could barely move. I glanced around. I was dry heaving and all of that, but I glanced around the room and it was covered in the empty vodka bottles, the overflowing ashtrays, the piss-stained mattress on the ground. I knew that something had to change. I was suicidal, but I was so low and defeated at the time that I figured that I'd probably find a way to mess that up too, just like I had everything else in my life up to that point. So that's when I kept just repeating that cycle, though, day after day, night after night, thinking that something would change. But I finally reached out for help, and my family helped me get into a treatment center out in California. I figured I'd go do 30 days of treatment, and then I'd be fixed. Right? We've all seen the commercial. I was an addict. Now I'm not. So 30 days at the time seemed like an eternity when I could barely stay sober for longer than 2 hours. So I go to California, I go to rehab, I do 30 days there, but I'm barely detoxed at that point. I mean, 30 days isn't very long. And I get out and I continue some outpatient groups and whatnot, but I got into a sober living house. And the thing was, in those early days at the sober living house, I actually hated myself more than I did in my active addiction because I couldn't numb the pain anymore of feeling uncomfortable in my own skin. And that's about the time that this group of men in recovery took me in. And this group of men, we did 12-step work together, and I learned how to be vulnerable in front of a group of men. But the biggest thing that they did for me was they showed me a new way of living. They taught me how to show up, how to be a man of integrity and accountability, how to better myself physically, mentally, emotionally, spiritually, financially. And we had a lot of fun in the process. You know, they kept telling me that we didn't get sober to live these small, boring lives, and so we had a good time when we were doing it. The thing was, though, that a lot of the majority of the people that I went to treatment with and that I got sober with at the time, I saw a relapse. They'd be back out on the streets, they'd be in active addiction, they'd be overdosing and dying. But in my circle of influence, it wasn't happening, and I didn't know why. So I just buried myself in closer to the safety of the pack. But what happened was over the next 8 years of my recovery, I saw that same cycle play out repeatedly, both in my personal life and professional life, and I kept seeing these gaps repeated in the system. Eventually, that led me to establish the nonprofit, the Abundance Foundation, in 2020 to address the gaps that I was seeing. Now, a lot of the statistics that I'm going to give you today are going to come from Colorado because that's where I'm from. But I would dare to say that these probably apply to states across the board. 51% of Coloradans struggling with a substance use disorder said that the fear of what would happen if someone found out was the leading reason that they didn't ask for help. So just getting somebody past the barrier of reaching out for help and letting them know that there's resources available, that's more than half of that 48 million right there. And then we run into the problems with the access to treatment. I mean, I did have PowerPoint here, but I keep forgetting. So then we run into problems with the access to treatment. So what we have here, I made this wonderfully constructed graph for you guys today. So, wrong way. I don't know how to use this thing. There we go. There's my graphic design skills for you guys. But it's going to be better than me throwing numbers at you. So on the left side, so we have the Medicaid population. So this group of people has very little access to resources. They have some detox centers, some treatment, some outpatient groups, but not a lot of access. Then the next group of people is actually a really significant group. So this group is still low income, but they're not low enough income for Medicaid and not making enough money to afford high-level treatment centers or have private insurance that covers treatment. So between that group of people and the Medicaid population, you have millions of people in this group, in this demographic that have the highest needs demographic and also the lowest access to resources. And so that's where we're at. The gap is the financial gap. So they are part of the 49% that has reached out and wants help, but they just can't get access to it for financial reasons. So now let's say, though, that somebody does get access to treatment, which only 14% of the 48 million people actually get access to. So maybe like a 30, 60, 90-day program, and then they're released back out into the world. So that's typically the same toxic environment that they came from, and it's with very little follow-up, maybe some suggestions for 12-step meetings, maybe some IOP, intensive outpatient groups, maybe a therapist referral, but no real accountability, support, or guidance on how to rebuild a life from ground zero. You know, it sounds really cool on paper to get a second chance, to get a chance to start over. And it's another thing to actually start over. Anybody who's ever been at a place where they've started over in life understands how true that is. So what happens? Well, we're creatures of habit. We go back to what's comfortable, even if it's what got us to rock bottom in the first place. 85% of those people that go to treatment relapse within the first year, and the majority of those is within the first 90 days, which is one of the leading contributing factors to the 800,000 plus overdose deaths in the last decade. So when we do the math out, that means that approximately only 2%, or 960,000 out of the 48 million people, are successful in their recovery beyond 1 year. So if that seems grim, it's because it is. This isn't the people failing the system, it's the system failing the people. Now let's see what happens if, so let's just say, for example, though, that somebody does get over a year of sobriety. They make it past that year, they're doing well, they're probably employed, but they're still living in sober living. They have some sober community, they're kind of connected, they managed to get a year behind them. Well, this ends up being a place where a lot of the times you hear things like, they were doing so well, and then I don't know what happened. Well, what happened is we get to this place of complacency. Like, I didn't become an addict and an alcoholic in 30, 60, or 90 days. I put a lot of hard work into that over a long period of time. Recovery is the same thing. We can't fix it in 3 months or 6 months or a year. It's a long-term process, so we need a process that goes for the long term. Right? So you see people that let me get past this. They get complacent with it, and that was the analogy I was going to use. Anybody that's ever worked in sales has heard the term, the fortune is in the follow-up. Well, we're not following up with this group of people, and we're seeing the consequences on the back end of that. So these front-end gaps here are the culmination of the things. What I want to go back to is that 800,000 overdose deaths right here, because I don't want to skip over this. So the culmination of those 3 gaps right there leads to this. Now, I didn't make this graph. This one came from the CDC. So the thing is, though, you see that little downturn there at the top on the right? Well, then the current narrative of that downturn is that now we're on the right track. We've turned a corner. I don't know. We turned a corner and somehow, and now we're improving, according to what that downturn is there from 2023. How about this for a narrative? When nearly 1 million people are dead, the curve comes down. That's math. Then we throw in, we can add, and what this graph doesn't reflect is the other CDC fun fact of the day. 50% of suicides are associated with dependence on drugs, and 25% of people with addiction to drugs and alcohol commit suicide. So when we factor in suicides and alcohol deaths, that 800,000 number, it nearly doubles to 1.5 million in the same 10 years. That right there is, now we're starting to see the big picture. We're starting to see the big picture of what this is becoming. I want to shift gears here for a second, though, because I don't want to overlook the economics of this situation. There's that mental health statistic. The economics 101. Economics 101 tells us what? Supply and demand. If there is a demand for a product or a service, there will always be a supply. And without the demand for a product or a service, there will be no need for a supply. So first of all, why the demand for drugs and alcohol in our culture? Well, you see, this is a cultural issue, and I don't mean a specific culture, I mean the overall American culture. Remember how I said I felt painfully uncomfortable in my own skin? Well, as much problems as the drugs and alcohol caused, they were also the best solution that I had to the pain points. They worked. It was temporary. I knew it wasn't going to be a long-term solution. I knew I wasn't going to be able to ride that train out forever, but it worked in the moment. And that became the comfortable known, right? I had a comfort zone of knowing that was going to be a fix for me at the time versus the uncomfortable unknown. If I didn't get that fix, I didn't know what a better solution to that was at the time because I knew at least what I could get by to make it work. And I, like most people in our society, have developed this behavior pattern over time of reaching for an external solution to fix an internal problem so that I didn't have to address the underlying feelings of the internal problem. That's the society that we live in. That's the product of living in an instant gratification culture. And we've been indoctrinated into that from a young age, to band-aid our problems, right? Feeling anxious, take this. Feeling sad, take that. All you got to do is turn on the TV to see Big Pharma's commercials. Wanting to celebrate, drink this. Use this. Do anything to escape what you're trying to do right now. And that's just been what we've had as a culture from the beginning. Then we introduce a drug like fentanyl, which is the cheapest, fastest, most potent way to absolve the pain points instantly, and we wonder why there's an epidemic on our hands? It's the best solution to the problem. You can call it the problem, but it's actually the solution for the people that are using it. Even in Big Pharma's current solution, MAT programs, medicated assisted treatment programs, like Suboxone and methadone, are just being used to band-aid addictions. They're not addressing the underlying root causes of the addiction. They're keeping people stuck in a cycle. We have this demographic of overly medicated zombies that are stuck in survival mode and calling it a solution. Has anybody ever seen somebody that misses their Suboxone medication for 48 hours? They're back out on the streets in 24, using the same drugs that they're taking the Suboxone for. So they're either back in active addiction or they're part of the 800,000 number. That's where they end up. There is a difference between keeping someone alive on a medication and saving a life. But now let's talk supply, because I do not want to overlook the supply chain of this. I don't know if you guys know much about fentanyl, but it is a synthetic opiate, meaning that it's manufactured in a lab. It doesn't come from a naturally occurring substance. So the precursors for fentanyl are manufactured in China, then they're sent to Mexico, where cartels manufacture it in a pill form or keep it in powder form, and they cut it into other drugs like cocaine, MDMA, methamphetamines, heroin, all of those things. You say, well, let's pause there. Why would they cut cocaine, which is a stimulant, with such an intense downer like fentanyl? Well, fentanyl is highly addictive. And so if you cut the right amount into it, it makes the cocaine highly addictive. It's a pretty good marketing plan by the cartel. But when somebody overdoses on cocaine that's laced with fentanyl, they just cut too much. We're not talking about FDA-approved labs that they're cutting fentanyl into cocaine at. They just make mistakes sometimes. And then what happens? So then they transport it over the borders to the U.S. A lot of people think that transport is just taking place in these like big undercover operations and whatnot, which it's not. Most of the transport is actually taking place at legitimate ports of entry. And you say, well, how can that happen? I thought we had Border Patrol and Homeland Security and DEA. Yeah, we do. And they're understaffed, underfunded, and they're just getting flooded at the border. If you put enough vehicles and enough people in one place, they can't check everything all the time. The cartels know this. They're not stupid. People think we have stupid drug dealers, and they're not. Cartels are run the same way that Fortune 500 companies are run. They factor all of this stuff into the business plan. It's not, they're not idiots. So and a lot of it's actually they're utilizing American citizens too. A lot of it's not even people from Mexico coming across the border. They find people in America that are in pretty desperate situations that are willing to work for them to transport it over. So say they have 10 trucks, and then they send all 10 to the border, that bust 5, but 5 make it through. So even when the DEA sees, what were the numbers on it? The DEA sees 29,048 pounds of fentanyl, 79 million pounds of fentanyl pills, and 430 kilograms of methamphetamine. It's just a drop in the bucket as to what's coming over. That was just 2023. That's how we end up with enough fentanyl in the country to kill every American more than once. We're not actually making a difference there. They can put the bus on the news to make it look like there's something happening, but it's not. So you say, okay, well, then the ones that do get busted, there's probably severe punishments for it. So let's look at the legislation and punishments for it. Now we're talking about, I remind you, we're talking about drug trafficking here. When I start talking about punishments, people start to get confused and think that I'm saying punish people that are using drugs. It's not the same thing. Traffickers versus users. Current legislation in Colorado House Bill 1326, says that possessing between 4 and 50 grams of fentanyl or a fentanyl compound with an intent to distribute will become a level 2 drug felony punishable by a prison term of 4 to 16 years. So, how much is 4 grams? Let's stop there. 4 grams is about the amount of a sugar packet. The perception is what we need to start changing. 4 grams doesn't seem like much, but I don't know if I can go back. Yep, there it is. But 2 milligrams, which is there on that pencil, is enough to kill someone. Meaning that 4 grams has the potential to kill 2,000 people. So now is the sugar packet a lot of fentanyl? Let's take the analogy. If I came up here and I was strapped with enough C4 to kill 2,000 people, would somebody ask questions? Would I maybe get detained? Would I maybe make the news? Now let's say that I did kill 2,000. Say I did something like that and I killed 2,000 people. What would be the punishment? Would I get a life sentence? Would I get the death penalty? Would I be a terrorist? Would I go down in history as something like one of the worst humans in history? But we're not looking at it the same way. 800,000 people dead. Somebody's responsible on the front end of that, but it's not happening. Other offenses become a level 1 drug felony punishable by a prison term of up to 32 years. If it leads to someone's death, if the drugs originated from outside of Colorado, or if the person possessed a pill press or other manufacturing equipment. Now stay with me. Pursuant to Title 21, United States Section Code 841, the distribution of a controlled substance resulting in death is a prison sentence upon conviction that is punishable by a minimum prison sentence of 20 years in prison and a maximum life sentence. I can get behind that. Seems reasonable. Here's the catch. How many people have actually been charged, convicted, and sentenced to it? Only a handful, and typically only high-profile cases. Why is that? Because here's the thing, the way our justice system is set up. It is on the prosecution to prove beyond a reasonable doubt that the person that was trafficking the drugs knew that it was going to lead directly to someone's death, which even with an overwhelming amount of evidence is incredibly difficult to prove in court. So unless you have an overwhelming amount of evidence and a really good lawyer, people are getting off with one of the lesser charges, meaning that the average sentence for fentanyl trafficking from the DEA is 74 months and 64 months in Colorado. Which means after time served, good behavior, early release, people are doing less than 2 years before they're back out for any trafficking charge. So let me ask you this then. If I'm a drug trafficker, why would I stop? What's any motivation to stop? I go do less than 2 years in prison, and I'm back out, the money's coming in, I got an unlimited customer base, me and anybody in my organization can do 2 years of prison time before we're back out. Why would I stop? So what is it going to take? What's it going to take punishment-wise before we actually start paying attention and making punishments that are deterrent enough where people actually think twice? Because if I'm one of those guys, I would do 2 years for that. The amount of money that's pouring in for that. All right. I did tell you that we were going to get to solutions, so let's start landing this plane. The solution is simple, but it's not easy. In 2020, I established the Abundance Foundation, which is a nonprofit aimed, like I said, at filling those gaps in the system. We take people through the hierarchy of needs, meaning that we first establish a safe, stable, sober place for somebody to land, and then we build from there. Sometimes this means that we get them into a detox or a treatment center. Sometimes this means that we're just getting somebody past the barrier of reaching out for help and letting us know that they need resources. Then we bring in a recovery coach, or sometimes called a peer support specialist. This is somebody who is in long-term recovery themselves and is now certified but not at a clinical level to help guide somebody through that early minefield of early recovery long enough for that person to be able to do it on their own. These recovery coaches provide that exposure to the new way of living the same way that group of men did for me early on. They hold accountability, affirm people's wins. They provide advocacy and support. I got a bunch of my team here today. They can tell you how many hats they wear. They're role models, mentors, resource navigators, connectors to supportive community, and one of those main pillars for rebuilding that life of purpose and hope. And this isn't a quick fix either. Like I said, like I've been saying, this is a long-term thing. It's about walking with someone for as long as it takes to get them back to self-sufficiency. They help people begin to develop their why, because when they figure out their why, the how we do it is easy. And the biggest piece of this is that we've been able to create this sober community of people that we can just plug people into now. So we, in addition to really doing like the counseling and the groups and the one-on-one sessions and all these logistical things, we have fun. We do camping trips and bowling and laser tag and movie nights and dance classes and fitness and all of these life skills things, and where we just are bringing people together. That includes these dinners that we run once a week on Friday nights, where we get between 80 and 100 people in the recovery community together to have dinner. I'll tell you where the miracles in recovery happen. It's not doing a worksheet in a treatment center. It's when you get 100 addicts together in a room to break bread and have fellowship and build relationships. And this isn't just like a kumbaya moment for me. Our statistics and our data that we've been tracking since October, we're only 3 years in, but we've only been tracking data since October, show this. Over 80% sobriety rate, over 90% reporting high quality of life in terms of physical, mental, and emotional health, nearly 90% reporting having strong support systems, nearly 90% reporting having a positive outlook over the next 6 to 12 months, and over half of the people since October are now what we consider successful, where they're employed, living in self-sufficient housing, and still sober. So, There is one last gap to this, though. I didn't want to miss this. We're only able to work with the Medicaid population right now. So anybody that's outside of that, we haven't been able to work with. To change this, we've been trying to start having talking about overall healthcare and getting rid of the separations of physical, mental, and behavioral health and start talking about wraparound levels of healthcare. The more that we can get people behind this idea, the more population we'll be able to serve. Because what happens, so here's what happens, because what happens if it doesn't change? Well, right now it costs the state of Colorado $4.5 billion annually and $740 billion to the country in terms of loss of productivity, crime, and healthcare related to substance abuse. That means that the system is strained. Medical system is strained, emergency services are strained, taxes and insurance costs go up. But more so than the financial side is the social fallout that we haven't even seen the full impact of yet. Johns Hopkins University in 2022 reported that the average lifespan of an American citizen went down by 0.67 years, which is over 8 months, because of the overdose deaths in the country. That means that we are going to have an entire missing generation of people. This is people that will never grow up to have families, build careers, build businesses like many people here, potentially world-changing ideas like AI, which so much of this has been about. We're going to miss out on that. We haven't seen the fallout of it yet, but over the next 20 to 30 years, you're going to see it, and if something doesn't change, we're going to see what the actual impact of that is. So what can you do to help? I just need I need you to leave here with 3 things today. Number 1, support local organizations. I talked a lot about state and federal levels. If there's something going on in your community, look for organizations that are already doing something there. If you don't have anything, reach out to me and my team. We're figuring out a way to expand what we're doing to other states, and so we can make something happen there. But whether that's your time, your resources, your finances, whatever that looks like, reach out to them and support them in that way. Number 2, your vote matters. Your vote matters when it comes to local issues, on ballot issues for treatment centers, treatment programs, specifically mental health facilities. There's a very large shortage of mental health facilities everywhere, including Colorado, that we've been able to find. Your vote matters when it comes to those issues. Your vote matters when it comes to funding for those places. And number 3, the last thing that I want you to leave with here today, clean up your own house first. What I mean by that is have a willingness and an openness to discuss it. You know, pick up that person that you raised your hand about earlier, pick up the phone and call that person. You don't have to have an answer. You don't have to have the solution. You just need to say, hey, I care about you. I want to see you get well, and I'm here to listen when you're ready. I thought I was anonymous in my addiction, but I wasn't. The damage was loud, and so I've chosen not to be anonymous in my recovery as well. You never know who needs to hear what you've been through and overcome, whether that's addiction related or not. Your story has the potential to help people, more so than you know. This is what being the change you want to see actually looks like in practice. We change the culture and we change the country by changing one person at a time, starting with the person 6 inches from the mirror. I'll leave you with one of my favorite scriptures. The light shines in the darkness, and the darkness has not overcome it. John 1:5. I hope I've been able to be that light today. Thank you.